heart blocks in under 10 minutes. Okay, so right away, let's get started. Let's start by telling a story. So, in a normal sinus rhythm, in a normal sinus rhythm, we have a newly married couple, a husband and wife, and every night the wife comes home, and every night the husband comes home, and here's the wife and the husband. And then we get problems, marital problems, and it's the first problem that pops up, so we call it a first degree. And the problem is the wife comes home on time every night, but the husband comes home a little bit later than normal. So imagine husband gets out of work at 5 p.m., but for some reason he gets home every night at 8 p.m. So you notice that, what is that time lapse there, right? So every night the husband gets home just a little too late. So wife's asking, why is it taking you so long? Oh, no reason. Stayed at the office, had extra paperwork to do, etc. He's starting to give excuses. That's the first degree. So if we move further down in the storyline, the problems start to worsen. So now we're looking at a second degree type 1. And in a second degree type 1, here's the wife. She's home on time as usual. Tonight, Monday night, for instance, the husband is home on time. But Tuesday night, the husband stayed out a little bit late. Sorry, honey, I had some paperwork to do. And Wednesday night, oh gosh, honey, I had a meeting and there was traffic and things were really hard to get home. And then one night, for the first time in their marriage, he just did not come home at all. Now, it's very hard to explain to your wife that you did not come home the night before. So he knows he's in trouble and he starts coming home on time for a little while until things die down and the relationships kind of goes back to normal. And little by little, he starts coming home late again and coming home later and later and later again until eventually he does not come home again. Right? So in a second degree type 1, you kind of notice it's getting longer and longer and longer until one day that QRS just didn't come home at all. Now in a second degree type 2, we'll put here second degree type 2, he knows he's been getting in quite some trouble with his wife. His wife is obviously suspecting that he's having an affair. So, in order to allow things to calm down, he starts coming home on time every night. So here you see P, QRS, P followed by QRS. And then one night he just messes up and he just doesn't come home again. So that's a big problem because the wife has warned him, if you do not come home on time every night, this relationship is over. And he was doing okay for a little while, but then he messed up and he did not come home one night. Then he tried to come back home on time the remainder of the week, but at this point in the marriage, the wife is fed up and now it's converted to a third degree. And in a third degree, the wife decides that two can play that game. And now here you see wife comes home, husband comes home, pretty normal night. And now the wife comes home at a different time than normal. And here the wife comes home. And now the husband is home, the wife actually gets there later than him. And then here you see the wife popping up at different times. Sometimes she does not come home before him. Sometimes she comes home way later than him, middle of the night, and she's obviously playing the same game that he's playing, and she's just coming home at whatever time she decides. Okay, so definition, and I believe the name gives away the definition. There is a heart block, and a heart block of what? Of electrical activity in the heart. So there's an electrical block. I'll just put here electrical. Okay, so as far as symptoms go, usually in a first degree and second degree type 1, these patients are usually asymptomatic, and your second degree type 2 and your third degree will present symptomatic. Now, what are the symptoms? Usually syncope or pre-syncopal events. Okay, in regards to diagnosing this, EKG is your gold standard. As far as treatment goes, in a first degree and a second degree type 1, because they are usually asymptomatic, no treatment is usually necessary. But if they are symptomatic, then usually you can pace them. In a second degree type 2 and a third degree, because they are symptomatic, you can pace them in an acute setting to bring their heart rate up, or you can definitively treat them with a permanent pacemaker. Okay, and lastly, let's take a look at a couple of vignettes. A 66-year-old female with a history of coronary artery disease presents with a new onset of dizziness and fatigue for 2 weeks. She recalls nearly passing out. Right, so a pre-syncopal event. On one occasion, examination is unremarkable except for bradycardia, so she has a slow heart rate. EKG reveals a heart rate of 50 with a normal PR interval followed by a normal QRS. There are several non-conducting P waves and no lengthening of the PR interval. Which of the following intervention is the therapy of choice? So in this case, we are looking at a Mobitz 2 because of the P waves with no QRS, and the PR interval has not lengthened. So it is not getting longer. It's just the QRS is just not coming home sometimes. So which of the following interventions is the therapy of choice? Well, this patient had a nearly syncopal event. So in this case, this patient is symptomatic, and the symptomatic treatment for these patients would be a permanent pacemaker. Okay, which of the following antihypertensive medications should be used with caution in a patient with pre-existing heart blocks? Well, you would want to stay away from anything that further slows the heart rate down. And do remember that beta 1 antagonists will slow the heart rate down in an attempt to lower the blood pressure. So beta blockers will not be recommended in this patient. Let's take a look at a couple of images to see if we can identify the type of heart block. So in this case, we have a P wave followed by QRS, P wave followed by QRS, and the PR interval seems to be consistent until one day that QRS did not come home. And in this case, very interesting, did not come home for 48 hours straight. That's definitely in trouble when you get home. So of course that P and that QRS is going to be very tight when he does get home for quite some time until the problem begins again. So in this case, we're looking at a Mobitz 2.